The blood hit the floor before the alarms did. 1 second, North Ravine Medical Center was an ordinary Thursday night in Callaway, Wyoming. The next, the emergency bay doors exploded inward, and soldiers in tactical gear were dragging men on stretchers through the rain, men with wounds that didn't look like any accident. Nurse Elise Harmon stood frozen at the nurse's station, while Dr. Garrett Voss, the most decorated trauma surgeon in the state, pointed at her like she was furniture. "Get her out of my ER." She had just saved a man's life using a technique Voss had never heard of. He had her suspended for it. What happened next destroyed everything he thought he was. If you're new here, stay until the end. Drop the name of your city in the comments. I want to see how far this story travels. The shift started the way bad ones always do, quietly. Elise Harmon clocked in at 6:47 p.m., 13 minutes before her official start time, because she always did. Not to impress anyone. Not for overtime, which she never got approved anyway. She did it because the evening handoff at North Ravine Medical Center was a disaster zone of incomplete charts and verbal shortcuts. And if she didn't read every note herself, something would eventually slip through the cracks and hurt someone. She had learned that the hard way, in a different country, under a different kind of pressure that no one at this hospital knew anything about. She pulled on her badge lanyard, the one with the frayed edge she kept meaning to replace, and walked the floor. North Ravine sat at the edge of Callaway, Wyoming, in the kind of town that got cold fast and stayed that way. The hospital had 240 beds, a trauma bay that was too small for the calls it took, and a reputation that had more to do with Dr. Garrett Voss than anything else. Voss had been the chief of trauma surgery for 11 years. He had a profile in a regional medical journal. He had his name on a wing renovation. He had a way of standing in the center of every room that made it clear he believed the room existed for him. Elise had worked here for 3 years and, in that time, had been promoted exactly once, to senior floor nurse, a title that came with no pay increase and a new set of responsibilities she absorbed without complaint. She was 31 years old. She was good at her job in a way that people around her had learned to rely on without ever quite acknowledging. When new residents got lost in the flow of a complex case, they found themselves drifting toward Elise. When a patient's family had questions no one else would slow down to answer, Elise answered them. When something felt wrong, a number that didn't track, a patient whose color was off in a way that hadn't hit the monitors yet, Elise was usually the one who caught it. She had never been thanked for this by anyone who held authority over her. At 7:20, she was checking vitals on a post-op patient in room 14 when she heard Voss in the hallway. His voice carried. It always did. "Where's the 7B chart? Someone moved the 7B chart." A resident's voice, thin and apologetic. "I think Harmon may have—" "I don't care what Harmon did. Get me the chart." Elise stepped out of room 14 and held the chart out without being asked. Voss took it without looking at her. That was normal. She had stopped waiting for different. The first real friction came at 9:15. A man named Dale Pruitt had been admitted 2 hours earlier with chest pressure and what the attending on duty had logged as likely musculoskeletal strain. He was 54, a former iron worker with the build of someone who had done physical labor his whole life and the pain tolerance to go with it. He had downplayed his symptoms at intake. She could see it in the notes, the way he'd said maybe a 6 when his face said otherwise. Elise had been watching his numbers since she started her shift. The EKG from 2 hours ago was sinus rhythm, but his pressure was creeping. His oxygen sat had dipped twice in the last 40 minutes, both times recovering before anyone flagged it. She flagged it. She found the resident assigned to Pruitt, a second-year named Marcus Webb, who was bright, genuinely careful, and already visibly exhausted at hour 9 of a 12-hour shift. "His sat dropped again," she said. "Twice. And he told me the pressure moved to his jaw 20 minutes ago." Webb straightened. "It's not on the monitor log." "Because it recovered each time before threshold. I've been watching him." Webb nodded, already reaching for his pager. "I'll get a repeat EKG and bump it up." What happened next was bad timing wearing the mask of authority. Garrett Voss walked past the nursing station at the exact moment Webb was flagging the concern to his attending, Dr. Patricia Souls. Voss was not Pruitt's physician. He had no involvement in the case. That did not stop him. "What's the situation?" he said, the way he always said it, not as a question, as a territorial claim. Souls explained. Voss glanced at the chart, then looked past her to where Elise was standing. Who flagged this? Nurse Harmon noticed the SAT pattern, Webb said. Voss looked at Elise the way people look at a check engine light, with the automatic assumption that the instrument is wrong. What's his EKG history? Normal sinus at intake, Elise said, but then it's likely anxiety. The man's in a hospital. People's numbers jump. He closed the chart and handed it back to Souls. Run a standard panel, give him something for the pressure, and get me a room 4 consult when it's free. He was already walking away. Elise looked at Souls. Souls looked at the chart. There was a specific kind of silence that happens in hospitals when someone with less authority than the person who just spoke knows something important and has to decide in real time how hard to push. Souls had been a physician for 6 years. Voss had been one for 22. The math of institutional weight landed where it always did. We'll run the panel, Souls said, not unkindly. Elise went back to Prewitt's room. He was sitting up slightly, jaw tight, pressing 2 fingers against his sternum like he was trying to hold something in place. Mr. Prewitt, she said, pulling her stethoscope, can you rate it for me again? 7, he said. Then, after a beat, maybe 8. She listened, asked him to breathe deep, asked about radiation to the arm. He hesitated. The hesitation of a man who didn't want to confirm what he was afraid it might mean. Left one, he said quietly. Yeah. She was back at the nursing station inside 90 seconds. Webb was at his computer. She put her hand on the edge of his desk. Marcus, STEMI workup. Now. Don't wait for the panel to come back. Webb looked at her. He was 27 years old and smart enough to understand what she was telling him, and he was also 27 years old in a hospital where Garrett Voss had just given a different direction. The door to Trauma Bay 1 swung open, and Voss walked out, already in conversation with a cardiologist named Dr. Howard Pell. They passed the nursing station without stopping. Webb made his decision. He ordered the workup. 22 minutes later, Dale Prewitt was in a cardiac intervention suite with a 90% proximal LAD occlusion, a widowmaker presentation, the kind that killed people when it got called anxiety, and sent home with a prescription for Ativan. Elise was at the nursing station finishing her documentation when she heard Voss's voice behind her, lower this time, stripped of the performance. Who escalated Prewitt? She turned. He was standing 4 feet away, and the thing about Garrett Voss up close was that he was a physically imposing man, tall, broad-shouldered, with the kind of face that had probably been handsome once and had since settled into something harder. He was not yelling, that was almost worse. Webb ordered the workup, she said. I gave him my assessment. I had already assessed that patient. You looked at a chart for 40 seconds. The silence between them had actual weight. You are a nurse, Voss said. Webb is a resident. You don't override attending direction. You document and you escalate through proper channels. I did escalate. Webb was the proper channel. You pushed a second year to contradict. The man had a STEMI. She kept her voice level. It cost her something, keeping it level. He's in intervention right now. Voss's jaw moved. The math of the situation was doing its work on him. The undeniable fact of it, the cardiac suite, the confirmed occlusion. And she could see him doing what powerful men do when the facts don't support the posture. He reorganized. He found a different angle. You've been doing this for 3 years, he said. 3 years at this facility. Do you have any idea the kind of liability? I know exactly what I was doing. Something shifted in his expression. Not respect. Something else. The recalibration of a man who has identified an obstacle. We'll discuss this with administration, he said. He walked away. Webb, who had been standing 12 feet behind Elise and had heard the entire exchange, came to stand beside her. He didn't say anything for a moment. Harmon, he finally said, you know he's going to... I know, she said. She pulled up her next chart. The meeting with administration happened 2 days later. North Ravine's hospital administrator was a woman named Sandra Kovac. She had been in healthcare administration for 19 years and had the particular skill set of someone who had learned to manage institutions by managing the people inside them, which meant, in practice, making problems disappear before they became liability. She was not cruel. She was efficient, and efficiency had a way of wearing cruelty's clothes when it landed on the wrong person. Elise sat across from Kovac in the fourth-floor conference room. Voss was not present, but his version of events was, in the form of a written statement that used phrases like circumvented clinical authority and pattern of insubordination, and her personal favorite, created an environment of confusion during patient care. She had saved Dale Pruitt's life. The written statement mentioned this the way weather reports mention things that passed through last week. Kovac folded her hands on the table. "Nurse Harmon, we value your commitment to patient outcomes. That's not in question here." "Then what's in question?" Kovac's expression didn't flicker. "Your conduct within the established hierarchy of this institution. Dr. Voss has significant concerns about..." Dr. Voss assessed a cardiac patient for 40 seconds based on a single EKG reading and called it anxiety. Dr. Voss is a board-certified trauma surgeon with... I'm aware of his credentials. Elise kept her hands flat on the table. "I've also been watching patients for 9 years. Before this hospital, in environments where missing something like that meant someone died outside a trauma tent with no intervention suite 300 meters away." She hadn't meant to say that last part. It came out clean and precise, and she watched Kovac's face shift slightly, not with understanding, but with the particular discomfort of someone who has just encountered a variable they didn't know was in the room. "Your previous employment," Kovac started, "is not in my file," Elise said quietly. "I know." It wasn't. She had made sure of that. The file showed 8 months of travel nursing between her military discharge and her first civilian position, and before that, a gap that HR had accepted without pushing because she'd come with strong references and clean certifications. Nobody at North Ravine knew she had spent 4 years as a combat medic attached to a joint special operations unit. Nobody knew she had done field surgery under fire in 3 countries. Nobody knew about the mission that had ended her military career, the one that was classified so deep it barely existed on paper, the one where she had taken a blame assignment that wasn't hers because the alternative was watching someone else's career and life get destroyed instead. She had left all of it behind. She had decided that civilian medicine was quieter, safer, and that quieter and safer was what she needed. She had been wrong about whether quiet would find her. Kovac cleared her throat. "We're going to recommend a 2-week administrative leave while we review the incident formally." "You're suspending me." "It's a paid leave pending..." "It's a suspension," Elise said, "over a cardiac intervention that saved a patient's life." Kovac's hands moved slightly on the table. "We need to ensure that the clinical chain of command is... You need to protect Garrett Voss." She said it without accusation, just with the flatness of someone naming a thing out loud. "That's what's happening here." Kovac stood. "Security will escort you to collect your personal items. Your badge will be deactivated at midnight." Elise stood too. She was 5'6", slight, with dark circles under her eyes from back-to-back doubles. She looked nothing like a threat. She had spent years cultivating that particular appearance, and it was not accidental. "Make sure someone watches Pruitt's potassium levels overnight," she said. "The night nurse on his floor is thorough, but she's covering 3 patients in post-cardiac obs, and she's going to be stretched." Kovac stared at her. "That's not... You don't need to." "It's a clinical note," Elise said. "Someone should write it down." She picked up her jacket and walked to the door. Behind her, she heard Kovac say something under her breath, but she didn't turn around. The security guard who walked her out was a young man named Terrence, who had once come to her with a badly infected finger. He was embarrassed to get formally treated. She had cleaned it and dressed it at the nursing station on her lunch break, and told him to see his doctor anyway. He didn't meet her eyes on the walk out. She didn't make him. Outside, the Wyoming evening hit her, cold and flat, and smelling like rain coming in off the mountains. She stood in the parking lot and felt the specific weight of someone who has just had a door close behind them that they didn't expect to close tonight. She drove home. She made rice and beans because she hadn't gone to the grocery store in 5 days. She sat at her kitchen table with her laptop and typed up a detailed incident report that no one had asked her for, with timestamps and patient numbers and exact quotes, because she had learned years ago that documentation was the only weapon that never ran out of ammunition. She emailed it to herself, encrypted the file, and saved it in 3 places. Then she sat back and thought about Dale Pruitt, who was probably in a step-down unit right now, with a stent holding his LAD open, watching television and texting his family, not knowing that a nurse he'd only half remembered was sitting in her kitchen across town, having lost her job for keeping him alive. She went to bed at 11 p.m. At 2:37 a.m., her phone buzzed. She picked it up expecting spam or a wrong number. It was Marcus Webb. His message was 3 words. Turn on the news. She reached for her remote. The footage was aerial, a Wyoming state highway, the angle just far enough to see the burning wreckage of what had been a military convoy. 3 vehicles, armored, the kind she recognized without having to think about it, which told her something immediately. She sat up. The chyron at the bottom of the screen said, multiple casualties reported, military affiliation unconfirmed, cause of explosion under investigation. Unconfirmed military affiliation. She knew what that language meant. It meant confirmed and classified, and someone was trying to hold the shape of a story before the actual facts blew it apart. Her phone buzzed again. Webb. They're bringing them to North Ravine. It's the closest trauma-capable facility within 40 miles. I heard on the scanner. Harmon. This is going to be bad. She was already standing. She put on her scrubs. Not because she had a job. She had been suspended 4 hours ago, and her badge was either already deactivated or would be at midnight, and it was 2:41 now, so she would badge in on an invalid credential, or she wouldn't badge in at all. She put them on because the thing about being who she was, the thing she had tried for 3 years to quietly unbe, was that the training did not have an off switch. When she had been a combat medic, her commanding officer had once told her that the best ones couldn't walk past a crisis. She had thought he meant it as a compliment. Later, she understood he was warning her. She drove. From 4 miles away, she could see the emergency bay lit up like something had gone wrong with the electricity. Too much light, moving wrong, the way emergency response lights moved when there were too many of them, and they were all going at once. She parked in the far lot and walked fast. The entrance to the ER was open in the way it shouldn't be. Doors propped, staff moving in short, hard bursts, someone from the charge desk speaking loudly into a radio. Elise moved through it the way she always moved through chaos, which was with the deliberate, unhurried stillness of someone who had learned that visible panic was a contagion. She saw Webb first. He was at the edge of trauma bay, too, with a clipboard, and his face when he saw her was the face of someone who had spent the last 20 minutes drowning and had just spotted something to hold on to. Harmon, he crossed to her fast. You can't be here. Your badge. Tell me what you have. He looked at her for a second, then made a decision. 8 casualties from the convoy. 3 are critical. 1 is VSA. We're working him. 2 have traumatic amputations, 1 partial, 1 full below the knee. There's a 7th. He dropped his voice. The 7th is different. The paramedics who brought him, they had a separate vehicle, separate team, and they handed off to Voss specifically. Nobody else. The guy has military ID, but something's wrong. Voss has been in there for 20 minutes, and I heard him call for a 3rd blood bag, and the patient's pressure is still dropping. What's Voss's read? Internal hemorrhage, he's treating for it, but the... Webb hesitated. The entry patterns on the wound don't match the blast injury. I caught a glimpse when they were moving him and Harmon. I don't know, it looked to me like it wasn't a blast wound, she said. Webb stared at her. Yeah. Show me. I can't show you. You're... A sound from inside Trauma Bay 1 silenced them both. Not a crash. Not an alarm. It was the specific low-frequency noise of a patient monitor descending into a tone that shouldn't be there, and then 3 voices at once, and then Voss's voice cutting over all of them, tight in a way she had never heard it. I need a chest tray. I need it now. Where is my... Webb moved. Elise moved with him. Inside Trauma Bay 1, the man on the table was in his 50s, lean, still in shredded tactical clothing that someone had partially cut away. His face was weathered in the way of someone who had spent years outdoors in difficult conditions. There was a central chest wound dressed with a pressure bandage that was saturated red, and 2 peripheral wounds on the left side that did not have the tearing pattern of shrapnel. Elise saw it in 2 seconds. She had seen that wound pattern before, twice. Once in the field, once in a classified debrief photograph. The peripheral wounds were pre-placed. This man had been shot before the explosion. Someone had put him in the convoy and then tried to kill him in it. Somebody get me I need visualization on the left chest. He's bleeding somewhere I can't. Voss was working, and to his credit he was working hard, but he was working from the wrong assumption, treating a blast injury that wasn't a blast injury, chasing hemorrhage from the wrong source. Elise stepped to the side of the table. You need to look at the anterior third intercostal, she said. He's got a fragmentation secondary at the rib margin. The blast damage is a cover. The primary injury is a penetrating wound they put shrapnel over. The room went very still for a half-second. Voss looked up. His eyes found her in the room, and the expression that crossed his face moved through 3 stages: recognition, disbelief, and then something she could only describe as the look of a man who does not want to be wrong. He stopped. You're suspended. You're not authorized. Listen to him, she said. He's not bleeding from the blast damage. You're chasing the wrong source. Get her out of this room. A nurse moved toward Elise. The monitor pitched lower. Garrett? It was the first time she had ever used his name. If you close that chest right now without finding the intercostal bleed, he will be dead in 8 minutes. Do the anterior third intercostal. Then you can call security. The monitor flatlined for 2 seconds, came back, flatlined again. Voss's hands were still. He was a surgeon. Whatever he was as a man, his hands knew their job, and they had gone very still in the way of hands that were about to act. Chest tray, he said. And then the front doors of North Ravine Medical Center came open, not the emergency bay doors. The main entrance, 30 feet down the corridor. They opened with a sound like pressure being released, a hard mechanical thunk followed by the specific quality of outdoor air and rain coming through on a cold night. Elise heard boots. Not one set. Multiple. Moving in the coordinated way that she recognized without having to think about it, because you didn't forget the sound of tactical movement if you had ever been inside it. She turned. The corridor filled. Special operations. Full kit. Not combat loaded, but equipped, with the specific posture of people who had moved into a space and were now controlling it. 6 of them, and behind them, in civilian clothes that didn't quite fit the way civilian clothes were supposed to fit, 2 federal agents with credential wallets already in their hands. And behind them, a man in a military dress uniform who moved like he owned every room he had ever walked into. The badge on his lapel caught the fluorescent light. Elise felt something cold move through her chest that had nothing to do with the temperature. She knew that badge. She had last seen it in a forward operating base in a country she wasn't supposed to have been in 6 years ago, on the chest of a man who had looked at her across a field surgical station and said, "You're the best medic I've ever seen in a combat theater," 2 days before her career ended. The man in the dress uniform stopped at the edge of the corridor. His eyes moved across the ER. They found Garrett Voss. They moved past him. They found Elise. He said, "I need the lead treating physician for the patient in Trauma Bay 1. Voss stepped forward. "I'm Dr. Garrett Voss, chief of—" "I need the person currently directing his care." Voss stopped. "That's—" Marcus Webb's voice from somewhere to Elise's left. Then silence. The man in the dress uniform looked at Elise with an expression that wasn't surprise. "Harmon," he said. Her last name, just that, in a voice that had not changed in 6 years. "Colonel Reeves," she said. The chaos in the ER did not stop. The other casualties still needed attention. The monitors were still alarming. There were still 2 amputees in Bay 3 and a VSA. They were still working in Bay 4. The hospital did not pause for the moment. It just continued around the 2 of them, and in the middle of it, standing 6 feet apart in a fluorescent-lit corridor in Callaway, Wyoming, were a military officer and a woman in borrowed scrubs with a suspended badge, and the space between them held 6 years of something that was about to crack open. "You're treating him?" Reeves said. "Voss was," she said. "I stepped in." Reeves looked at Voss, then back at her. "Status?" "He's alive. Voss is opening the chest now. He had a penetrating wound covered with blast debris." She stopped. dropped her voice. Colonel, this wasn't an accident. Reeves's expression did not change in the way of someone hearing new information. It changed in the way of someone whose worst operational concern had just been confirmed. I know, he said. And in Trauma Bay 1, behind them, through the glass panel in the door, the monitor's tone shifted, rose, and she heard Voss say, in a voice stripped of everything except the pure clinical fact of it, "Got it. Bleeding's controlled. BP is coming up." The man on the table, Sasio, whoever he was, whatever had brought him here inside a burning convoy on a Wyoming highway at 2 a.m., was still alive. For now. Reeves turned back to Elise. His eyes were the same as she remembered, calm in the specific way of someone who had decided to be calm, not someone who was. "We need to talk," he said. "Not here." One of the federal agents had moved to the nursing station and was speaking to Sandra Kovac, who had apparently arrived at some point in the last 4 minutes, probably when the soldiers walked in, and whose face was doing something Elise had never seen it do before. It was afraid. Elise looked at Kovac. Kovac looked at Elise. The federal agent was saying something to Kovac in a low, professional voice, and whatever it was, Kovac was not arguing. Reeves said, "Your clearance is still active, Harmon. I never pulled it." She turned back to him. "You never told me that." "You never asked." A pause. The first fracture in the professional calm. "You disappeared. 6 years ago, you took the file reassignment, and you just—" He stopped himself. "Reset. We'll debrief. But right now I need you in that room." She thought about the man on the table, the wound pattern, the precision of it, the way someone had pre-staged the injury and then tried to hide it inside an explosion that was designed to look like everything was accidental. She thought about Sandra Kovac's face. She thought about all the things she hadn't let herself think about for 3 years, working this quiet hospital in this cold town, trying to be background noise. "Who is he?" she asked. Reeves looked at the door of Trauma Bay 1. "His name is General Marcus Aldred," he said, and he was 3 days away from testifying before a federal oversight committee about illegal procurement contracts worth $400 million. He paused. "The people who put him in that convoy want him dead before he gets there." The federal agent at the nursing station was now standing very close to Sandra Kovac. Kovac's hands were on the counter, flat, still, like someone who had been told not to move them. Kovac's hands didn't move. That was the thing Elise kept coming back to in the seconds after Reeves said Aldred's name. Not the name itself, not the number attached to the contracts, not even the word testifying and everything it implied. It was the stillness of Sandra Kovac's hands on that counter. The way they had gone flat and motionless the moment the federal agent stepped close. Not the stillness of shock, the stillness of someone who had rehearsed for a version of this moment and was now running the internal calculation of how far it had deviated from the script. Elise had seen that specific stillness before. In a different context, under different lighting, in the face of a logistics officer who had been moving weapons through a supply chain he wasn't authorized to touch. The body knew before the mouth decided what to say. The hands went first. She filed it away. Reeves was already moving toward Trauma Bay 1, and she moved with him because the alternative was standing in the corridor, and the corridor was no longer a safe place to think. Behind them, she could hear the federal agent asking Kovac for access to the administrative server, and she heard Kovac begin to explain something about data privacy protocols in the carefully modulated tone of someone stalling. "Walk me through what you saw," Reeves said, low, not looking at her. 3 wounds. The central chest wound is consistent with blast fragmentation. That's the presenting injury. That's what the paramedics documented. But the 2 left lateral wounds aren't blast. They're too clean, too deep. Entry angle is wrong for explosive debris. Someone put 2 rounds in him before the convoy went up and then positioned him inside the wreckage. Time between shooting and explosion? Close. Minutes, maybe less. The wounds had started to bleed internally before the blast. I could see the bruising pattern under the shrapnel entry, but nobody who wasn't looking for it would have separated the 2 injury types. Voss wasn't looking for it. Voss was treating what the paramedics gave him. Reeves pushed the door to Trauma Bay 1. Inside, the room had settled into the particular controlled rhythm of a patient who had been pulled back from the edge and was now being held there by equipment and attention. Aldred was intubated, 3 lines running, a chest tube draining bloody fluid into a collection chamber on the floor. Voss was at the foot of the bed, dictating to a scrub tech, and the monitors showed numbers that were still dangerous but were moving in the right direction. Voss looked up when Reeves entered, then at Elise. Something moved across his face that wasn't quite anger anymore. It had compressed into something smaller and tighter, something that would need to find an outlet later when the room wasn't full of federal presence. "He's stable for now," Voss said to Reeves, not to Elise. "BP is 88/60, trending up. We have the hemorrhage source controlled. I want to get him to CT before we make any surgical decisions about the—" "He doesn't go to CT," Reeves said. Voss paused. "He has potential intracranial involvement from the blast concussion. I need to rule out. He doesn't leave this room until my team has secured the route and cleared the imaging suite." Reeves's voice was not raised, not aggressive. It had the particular quality of someone stating physics. "Your technician will wait outside. My people will sweep the corridor." "This is my hospital," Voss said. The word "my" landed with all the weight he had behind it. Reeves looked at him for exactly 1 second. "Dr. Voss, with respect, this is now a federal medical emergency under Title 10 authority. Your facility is supporting my operation. I appreciate your work on this patient tonight, but the decisions about movement and security are mine." Voss's jaw tightened. "And regarding Nurse Harmon," Voss started. "Nurse Harmon is reinstated effective immediately under emergency medical personnel authorization. I have the authority. It's done." Reeves looked at Elise. "Stay with him." He walked out. The room held a silence that had texture to it. The scrub tech was looking at a spot on the wall. The monitor beeped. The chest tube dripped. Voss looked at Elise. Not the way he'd looked at her for 3 years. Not through her, not past her. Not with the reflexive dismissal of someone who had long ago categorized her as furniture. He looked at her with something approaching the expression of a man trying to recalculate a sum that keeps coming out differently than he expects. "The intercostal bleed," he said. "Yes." "You identified it before I opened?" "Yes." A long beat. "How?" It wasn't quite a question. She understood what he was actually asking, which was the larger thing. Not just the clinical finding, but the architecture behind it. The years that had produced a nurse who could walk into a trauma room and identify a staged wound pattern in under 2 seconds. "I've seen it before," she said. She moved to Aldred's bedside and checked the chest tube output without waiting for direction. Voss watched her. He didn't say anything else, which was, she supposed, as close to acknowledgement as the night was going to produce. Outside the glass panel, she could see 2 of Reeves's soldiers positioning themselves at the corridor junction. One of the federal agents was on a phone call, walking in tight circles near the nurse's station. Sandra Kovac was still at the counter, but now there was a second federal agent beside her, and they were looking at a laptop screen together. Or rather, the agent was looking at it, and Kovac was looking at the agent. Marcus Webb appeared at the door and knocked on the glass. Elise crossed and opened it 2 inches. "What's happening out here?" he said, quiet, strained. "Controlled." "That's not an answer." "It's the answer I have right now." She looked past him. "How are the other casualties?" "The VSA didn't make it. The 2 amputees are in surgery. I got Dr. Pell for one of them. The rest are being stabilized. It's— Harmon, there are soldiers standing at every exit." "I know. Are we in danger?" She considered the honest version of the answer, which was potentially, and the practical version, which was what he actually needed to hear. "Not from the people who just came in," she said. "Stay with your patients. Stay away from Kovac's office." Webb stared at her. "Why would I—" "Marcus." She said his name the way she said things when she needed them to land cleanly. "Trust me right now and ask questions later." He nodded, slow, and moved back into the corridor. She closed the door and turned back to Aldred. His pressure was at 94/62 now. Still critical, but the trend was there. She checked his pupils, unequal but responsive, which suggested concussive involvement that would need imaging, but the immediate hemorrhagic threat was controlled. She checked the intubation placement, the line sites, the chest tube seal. All of it was meticulous. Whatever Voss's flaws as a human being in this building, his hands were good, and he had controlled the bleeding precisely once she'd pointed him to the right source. She hated that she had to acknowledge that, but she did. Aldred's chart was thin. The paramedics who'd brought him had logged almost nothing. Name, military ID number, presenting vitals. No history, no medication list, no emergency contact. The military ID number was formatted in a way she recognized from a very specific classification level, which told her that whoever had built this convoy had done so from a command structure that didn't put its documentation where civilian contractors could touch it. She was looking at the ID number when a detail caught her. She looked at it for a long moment. Then she looked at the wound pattern again. The left lateral wounds. She had said they were too clean for blast debris. That was true, but she had been focused on the immediate clinical picture, control the bleed, stabilize the pressure, and she had not had the bandwidth in the moment to think about the geometry of the shots. She thought about it now. The angle of entry on the upper left lateral wound was slightly downward. The lower wound was almost perfectly horizontal. For both rounds to have been fired by the same person, the shooter would have needed to change position between shots, or Aldred would have needed to be moving. But the wound margins were consistent in their age, fired within seconds of each other. Two angles, same time frame, two shooters. She straightened, looked at the door, looked at Reeves through the glass as he passed the corridor. He had his phone out and was speaking with intensity into it, and one of his soldiers was tracking something on a tablet. Two shooters meant coordination. Coordination meant planning. Planning of this sophistication, targeting a military general inside a moving armored convoy and then destroying the convoy to cover it. That was not a crime of opportunity. That was an operation. That required intelligence. Insider intelligence, most likely, because you didn't intercept a classified military convoy on a Wyoming highway without knowing the route, the timing, and the security configuration. Insider intelligence meant someone with access had fed it out. She looked at the door again. Through it, at the nurse's station, at Sandra Kovac's flat hands on the counter. She looked at Aldred's chart, at the military ID number. She thought about what Reeves had said, testifying before a federal oversight committee about illegal procurement contracts worth $400 million. She thought about Kovac's career history, which she had never thought about before because she had never had reason to. Kovac had arrived at North Ravine 4 years ago. She had restructured several of the hospital's supply and procurement contracts in her first 18 months. Elise had heard this secondhand from a supply manager who had complained about vendors changing, about new processes that added administrative layers without apparent purpose. She needed to see the procurement files. That was not a thought she should be acting on alone in a trauma bay while her patient was critical. She knew that. She also knew that the window for evidence to remain accessible, if someone in this building knew federal agents were on the floor, was narrowing in real time. She checked Aldred's BP one more time, 97/64, still climbing, slowly, and crossed to the door. Reeves was off the phone when she found him. "I need 5 minutes," she said. He looked at her. "Harmon, the wound geometry. It was 2 shooters, not 1. Different entry angles on both lateral wounds, fired within the same short window. This was coordinated with inside information." Something in Reeves's expression went very tight, very controlled. "We have investigators. Your investigators don't know this building. I do." She kept her voice down. "If someone in this hospital fed out Aldred's convoy information, they're going to be moving right now to clean up any local evidence. Digital records are easier to wipe than people think, especially if you have admin access." Reeves looked past her to the federal agent still standing near Kovac, then back. "You're not an investigator," he said. "I'm the only person in this building right now who knows both sides of what's happening in it." A moment. He was weighing things she couldn't fully see. Operational protocols, chain of command, liability, the dozen variables a man in his position had to track simultaneously. She waited. She had learned a long time ago that pushing Reeves past the point he was ready to move produced results slower than letting the calculation run. "Agent Solis," Reeves said. The female federal agent near the nursing station turned. "Work with Harmon on the administrative level. Full cooperation." Solis crossed the floor with the economical movement of someone who had spent years covering ground efficiently. She was mid-30s, dark-haired, with the particular flat effect of someone who processed information quickly and expressed it minimally. She looked at Elise with assessment, not deference. "What are we looking for?" Solis said. "Procurement contracts, vendor files, anything that touches federal medical supply agreements, particularly in the last 4 years." "That's a broad pull. I can narrow it. I know the filing structure in this building." Elise glanced toward Kovac, who was now being asked to sit down by the second federal agent, which she did, in the particular way of someone who has run out of delay tactics. "And I need to get to it before whoever has admin access decides the server needs maintenance." Solis held her gaze for one more second, then turned. "Come on." The fourth-floor administrative corridor was quiet in a way that hospital corridors were almost never quiet, even at 3 in the morning. The overhead fluorescents buzzed. Their footsteps were the only sound. Solis had her credentials out before they reached the server room, a repurposed supply closet near the end of the hall that Elise had been in exactly once 2 years ago when IT had asked her to sign a data policy form. The server room door was closed. The keypad beside it showed a green access light. Solis looked at the green light, then at Elise. "Should be requiring a badge read to get in," Solis said. "It's already been accessed," Elise said. "Recently." Solis pushed the door. It opened. The room was empty except for the hum of equipment and the blinking status lights on 2 server racks. Everything looked undisturbed, but in the corner, the workstation terminal had a screensaver running, the automated blank screen that appeared after 5 minutes of inactivity, which meant someone had been at this terminal no more than 5 minutes ago. Solis pulled on a pair of nitrile gloves from her jacket pocket, crossed to the terminal, and tapped the spacebar. The screen came up, logged in, with an open file directory window. The directory path was admin, greater than contracts, greater than federal, greater than 2022 to 2024, greater than archive. Several files in the archive folder showed a modified timestamp of 3:04 a.m. It was currently 3:09 a.m. "Someone was here 5 minutes ago," Solis said, already pulling out her phone to document the screen. "They were deleting files," Elise said. She moved to the second terminal against the wall, the IT monitoring station, and sat down. The username and password were written on a sticky note on the monitor's frame, because this was a hospital, and this was always how it was in hospital server rooms, and the IT manager had complained about this sticky note 3 times in staff meetings. She logged in. "You can't access," Solis started. "I'm not accessing anything protected. I'm looking at the server activity log." Elise pulled up the log. "This is what the system records every time a file is opened, moved, or deleted. It's an audit function. It's not privileged data." Solis came to stand behind her. The log showed a login at 2:58 a.m. under administrator credentials. 11 files opened, 7 files moved to trash. 3 files opened and resaved with modification timestamps updated to overwrite their creation dates, a clumsy attempt to make old files look like recent routine documents. Elise looked at the administrator credential name. It was generic, admin02, which meant it was a shared account, the kind that gave multiple users deniability, but the login had been authenticated from a specific terminal. She pulled the terminal ID 4th floor, room 407. Sandra Kovac's office. "He was up here," Elise said, "right after the soldiers came in while everyone was focused on the ER floor. She came up here and she tried to clean the contract files." Solis was already on her radio, low and precise, calling it down to the floor. Elise kept moving through the log. The 7 deleted files were in the federal contracts archive. The 3 resaved files were interesting. If you were deleting incriminating files, you resaved others to create a version of the record that looked clean. She pulled the names of the resaved files. 2 were vendor agreements, standard formatting, hospital letterhead. But the 3rd one had a file name that used a prefix she recognized, a contract numbering format that matched a federal procurement classification she had seen exactly once before in a document that passed through her forward operating base 6 years ago, attached to a supply request that nobody on her unit had made. She stared at the file name, NRMC-FED-0 medsu P-2 023 AL DRED-REVIEW. Aldred. His name was in the file name. This wasn't a hospital that had accidentally gotten caught up in something. North Ravine Medical Center had a specific documented contractual relationship with a federal procurement process that General Marcus Aldred had been investigating. The hospital wasn't collateral. The hospital was infrastructure. "Solis," she said. The agent was still on her radio. She looked up. "This hospital is named in Aldred's oversight file," Elise said. "Kovac didn't just have access to his convoy information. This facility has been part of the contract network he was auditing." Solis went still. "How confident are you?" "The file name matches the review classification format from his investigation. I'm looking at it right now." Solis was on the radio again before Elise finished the sentence, and Elise could hear the register of urgency shift in whoever was on the other end of the line. She printed the activity log. Then she photographed the screen with her phone. Then she pulled the physical server access record from the binder on the wall beside the rack, the paper sign-in log that IT kept as redundant documentation, and found the entry from 2:58 a.m. The signature in the space was Kovac's. She had physically signed in. She had walked up here, logged into the admin terminal, and started deleting files, and she had signed the paper log on the wall because she had been doing it for 4 years, and the habit of the routine had overridden the panic of the moment. Elise stood there for a moment with the paper log in her hand and felt something that wasn't quite satisfaction, because satisfaction implied the thing was over, and it was not anywhere close to over. She thought about Dale Pruitt in his step-down unit, 3 floors below her in this building, with a stent in his LAD and no idea what was happening above him. She thought about Marcus Webb down in the ER, running himself ragged across a floor full of military casualties, and trying to make sense of a situation that had just cracked the entire structure of his professional world wide open. She thought about Aldred on the table, 2 shooters worth of damage in his chest, breathing because a machine told him to. She thought about Garrett Voss, standing at the foot of that table, who was a complicated and difficult man but whose hands were good, and who had in the end made the right call when the moment required it, and who had almost been used, unknowingly, she was nearly certain of it now, as a professional buffer to keep Aldred from receiving the correct treatment, keep the most visible, most credentialed surgeon in the building focused on the wrong injury. If Aldred died of internal hemorrhage that Voss missed, it was Voss's fault on paper. It was clean. It was deniable. Except Elise had been there. She had been suspended and should have been home. She had been background noise for 3 years. She had been walked out of the building by a security guard who couldn't meet her eyes. She handed the paper log to Solis. "That's her signature," she said, "and the timestamp is 2:58 a.m., 7 minutes after the soldiers came through the front door." Solis took it. Her expression was the contained professionalism of someone who had been trained not to show what they were thinking, but her eyes had changed in a way that confirmed she understood the weight of what she was holding. They went back downstairs. The ER floor was a different environment than when Elise had left it. The operational chaos of mass casualty intake had settled into the managed intensity of stabilized patients, and the soldiers at the exits had been joined by 2 more federal agents who were now in conversation with a man in a suit who had arrived sometime in the last half hour and who had the specific energy of a federal attorney, controlled, expensive, already sorting what was usable and what wasn't. Reeves was at the nursing station with his tablet. He looked up when Elise and Solis came through. Solis gave him the printouts and 2 sentences. Reeves looked at the file name on the activity log, looked at Kovac's signature on the paper sign-in, and made a sound low in his throat that was not quite anything expressible. "Where is she?" he said. "Still at the counter," Solis said. Kovac was still there. Same position, same stillness. But the second federal agent who had been with her was now standing slightly behind her chair rather than beside it, and the change in geometry was deliberate and clear. Reeves walked to her. Elise followed, not because anyone had asked her to, but because she had been inside this building's structure for 3 years, and she understood things about the architecture of what had been built here that the federal agents didn't, and she was not going to stand back now. Kovac looked up when they stopped in front of her. She was a composed woman. Elise had always known that about her, even when composure was being used against her. The composure was still there, but it had cracks in it now, fine lines running through the facade in the way of a wall that has taken structural damage and has not yet fallen, but will. "Ms. Kovac," Reeves said, "I need to speak with you about your administrative activity approximately 11 minutes ago and your institution's contractual relationship with the Federal Medical Procurement Review currently under General Aldred's oversight." Kovac's eyes moved, not to Reeves, but to Elise. Just for a second. One fast, calculating assessment. "I want my attorney," Kovac said. "That's your right," Reeves said. "We'll facilitate that. In the meantime, you'll remain here." Kovac looked back at the counter. Her hands were still flat on it. Elise turned away. She needed to get back to Aldred. The pressure trend was stable, but stable at a critical level was not the same as safe, and CT clearance was going to need to happen soon, regardless of corridor security concerns. She moved toward Trauma Bay 1 and was 10 feet from the door when Garrett Voss came out of it and nearly walked into her. They both stopped. He had his surgical gloves in one hand and his phone in the other, and for a moment they simply stood in the corridor, two people who had spent 3 years in a building together without ever quite seeing each other clearly. "He's holding," Voss said. "Pressure's up to 104/68. Good." A beat. He was looking at her with an expression she had never seen him wear before. Not in 3 years, not in any interaction, not even in the moments when she'd been in the room when something went right. It was the expression of a man who was reconsidering a story he had told himself for a long time. "Who are you?" he said. Not unkindly, just with genuine uncertainty. She considered the several accurate answers to that question. "I'm the nurse who flagged your cardiac patient 2 days ago," she said. She pushed through the door to Trauma Bay 1. Aldred's vitals were better than when she'd left, which was the first purely good piece of news in the last hour. His pressure was where Voss had said. His pulse ox was 97% on the ventilator. The chest tube drainage had slowed, which meant the controlled bleeding was staying controlled. She adjusted his IV rate slightly. He was still volume depleted, and they were going to need to stay ahead of it, and checked the chest tube seal again. She was pulling back from the bedside when she noticed his hand. He had been unconscious since intake. He was sedated, intubated, and by all clinical measures unresponsive. But his right hand, which had been laying flat on the gurney rail, had moved. His index finger was extended slightly, pressing against the metal of the rail in a way that could have been involuntary muscle activity. But it was tapping. Slow. Deliberate. A pattern. She stood very still. 3 short, 3 long, 3 short. Her mouth went dry. She leaned over him. His eyes were closed, sedated. His face was still. Nothing had changed in his presenting status, but his finger was moving against the rail with a rhythm that was not random. She put her hand over his. Gently, not restraining, just contact. His finger stopped. Then it tapped twice. She looked at the door. Through the glass, the corridor showed Reeves on the phone, Solis talking to the federal attorney, soldiers at the exit. Normal, in the current version of normal. She looked back at Aldred. She leaned close to his ear. "General, if you can hear me, I'm Elise Harmon. You're at North Ravine Medical. You're alive. The hemorrhage is controlled. Colonel Reeves is here." Nothing. Then, barely perceptible, the smallest possible movement. The finger tapped once. Her pulse spiked. If he was responsive to sound even under sedation, his neurological status was significantly better than the imaging could currently tell her, which changed the CT calculus. But more than that, if he was responsive, he might have information that couldn't wait for him to be fully extubated and alert. The window for acting on whatever he knew was the same window for evidence to survive or be destroyed. She straightened and pulled out her phone. She was halfway through typing a message to Reeves when the overhead lights in Trauma Bay 1 went out. Not the emergency backups, not a flicker. The primary lights, all of them, instantaneous. The monitors stayed on, battery backup. The equipment kept running, but the bay went dark except for the blue-green glow of the screens, and through the glass panel in the door she could see that the corridor lights had gone out too, and she could hear, under the monitor tones and the ventilator rhythm, the sound of the emergency generator trying to cycle and not catching. Someone had cut the primary power. She was at the door in 3 seconds, pulling it open. The corridor was in emergency lighting now, the red-tinted backup panels casting everything in a low, flat light that flattened faces and distance and made the space feel suddenly smaller. Reeves was already moving, 2 soldiers tracking behind him, and down the far end of the corridor near the stairwell, she heard a door bang open. She looked at the nursing station. Sandra Kovac was gone. The chair she had been sitting in was pushed back at an angle. The 2 federal agents were looking at each other across the empty space she had occupied 3 seconds ago. The counter was bare except for the flat palm prints her hands had left in whatever had been spilled there earlier. 2 clean shapes of absence pressed into the surface like a record of a person who had just stopped existing. One of the agents was already running for the stairwell. The other had his radio up. Reeves reached Elise. "She's moving." "I know." Elise was already calculating. "There's a service corridor on the 2nd floor, connects to the loading dock. It's not on the main evacuation map. It's in the original building plans. I found it 2 years ago chasing a supply discrepancy." She looked at him. "If she knows this building and she's trying to run, that's where she goes." Reeves looked at the stairwell door swinging closed, then at Elise. "The path," he said. She ran. The stairwell was cold and smelled like concrete dust and old paint. She took the stairs fast, her hand on the rail for the corners, the emergency lighting pulsing red above each door frame. Reeves was behind her, one of his soldiers ahead, and somewhere above or below her in the building's vertical structure, Sandra Kovac was moving through the same dark with the specific desperation of someone who had just watched their carefully constructed world come apart in under an hour. 2nd floor landing. She pushed through the door. The service corridor was to the left, behind the supply staging area. She moved through the staging room, past shelving units of IV supplies and linen packs, to the unmarked door at the back. It was standing open. Beyond it, the service corridor ran 40 feet to a heavy exterior door with a crash bar. The exterior door was closed. In the middle of the service corridor, Sandra Kovac was standing with her back against the wall, her phone pressed to her ear, speaking in a voice low enough that the words didn't carry. She had her badge in her other hand, already removed, already ready to be discarded. She looked up when Elise appeared at the door. For a moment, neither of them moved. Kovac's face in the dim service lighting was the face of someone who had just run out of options and knew it, and was doing the rapid internal math of a person who has spent 19 years in healthcare administration learning how to manage problems before they became visible. Elise had always thought of Kovac as composed in the professional sense, the composure of competence, of someone who was good at their job. She understood now, looking at her in this corridor, that it had been a different kind of composure. The composure of someone managing secrets. There was a difference, and it was showing now in every line of Kovac's face. "Harmon," Kovac said, just her name, the way Reeves had said it, but with entirely different content. "Put the phone down," Elise said. Kovac's jaw moved. Her eyes moved to the door behind Elise, calculating. "There's a soldier on the other side of the exterior door," Elise said. That was a guess. She was reasonably confident it was a good guess, but it was still a guess. Kovac's eyes came back to her. "You don't understand what this is," Kovac said. Her voice had changed. The administrative smoothness was gone, and what was underneath it was something rawer and stranger, not quite fear and not quite anger. "You think this is just a hospital. You think I made decisions in a vacuum. I think you fed convoy routing to people who shot a federal general and tried to burn the evidence," Elise said. "Whatever story surrounds that is a conversation for attorneys. He was going to destroy programs that—" Kovac stopped. "You don't know what's at stake. The contracts he was targeting, the procurement structure, there were people depending on—" "Ms. Kovac!" Reeves's voice came from behind Elise. He had come through the staging room quietly. He stopped beside her. "Step away from the door." Kovac looked at him. Something in her expression fractured. Not broke, but fractured. The way something does right before it decides which way to fall. Her phone was still in her hand. She looked at the screen. Then she looked at Elise, and the expression on her face in that moment was the most unguarded thing Elise had ever seen from this woman. 3 years of professional interactions compressed into a single second of something that might have been, If the situation were entirely different, the look of someone who recognized they had misjudged a person badly and was only now understanding the full scale of it. "You were just supposed to leave," Kovac said. The words were quiet. They were, Elise realized, actually directed at her, not at Reeves, not at the soldiers, not at the abstract forces that had descended on the building tonight. At Elise, specifically. You were just supposed to leave. She had walked her out of the building 6 hours ago. Badge deactivated, security escort, 2-week administrative leave pending formal review. Kovac had moved her out of the way, had done it cleanly, professionally, with the minimum of friction necessary to remove a variable that was becoming inconvenient. And Elise had driven home and made rice and beans and gone to bed and gotten a text from a resident at 2:37 in the morning. "I know," Elise said. "I just didn't." Kovac's phone screen lit up in her hand, an incoming message. Elise caught one word in the preview before Kovac's fingers closed over the screen, but one word was enough. The word was run. Kovac's body shifted. Reeves moved. The soldier came through the exterior door. She had been right about that. And the service corridor became very small and very full in the space of 2 seconds. Kovac didn't run. There was nowhere to run to, but her hand moved fast, faster than Elise expected, and the phone went sideways, spinning toward the gap between the wall and the shelving unit at the corridor's edge, dropping into the dark space there. And Kovac's face went smooth and administrative again in the instant before Reeves's hand came down on her shoulder. "Sandra Kovac, you are being detained." But Elise was already crouching at the shelving unit, reaching into the dark gap, her fingers finding the phone on the floor. She picked it up. The screen was still lit. The message was still visible. She read the full message. Then she stood up slowly. She read it again to make sure she was seeing it correctly. The message was from a contact saved under a single initial, V, and the message said, "Aldred knows about the second file. He hid a copy. Get it before Reeves does. It's in the hospital. He planted it during the last inspection. Burn everything." She looked up at Reeves, who had Kovac's arms behind her back, and was reading her rights in the careful, measured tone of someone who had done this before and understood the importance of doing it correctly. She held up the phone. "Reeves," she said, "there's a second file. Aldred planted it here, in this building, during a previous inspection." The corridor went very quiet. "It's still here," she said, "somewhere in this hospital." And from upstairs, muffled through 2 floors of concrete and steel, came the sound of an alarm. Not a medical alarm, not a cardiac monitor or a ventilator warning, but the specific high electronic pulse of the server room intrusion detection system, which meant that someone, somewhere in this building, was accessing something they were not supposed to access. Someone who was not Sandra Kovac. Someone who was still free. Reeves didn't waste a second. He handed Kovac to the soldier and was already moving before Elise finished the sentence, his radio up, barking a corridor designation to whoever was monitoring the building from outside. Elise was right behind him, because standing still was not a thing she was capable of doing right now, and because she knew this building's floor plan better than anyone currently running through it. The server room intrusion alarm was still pulsing when they hit the stairwell. "Second person," Reeves said, climbing. "Not Kovac." "The message came from someone called V," Elise said. "Kovac wasn't acting alone. Someone else has been running parallel. They knew about the second file before we did. Aldred planted it during a hospital inspection." Reeves pushed through the 4th floor door without slowing. "That would be on record. Inspection dates, visitor logs. 3 months ago," Elise said. "There was a federal medical compliance review. I remember because Kovac had us deep cleaning the supply rooms for 2 days before it. I thought it was standard." She thought about it moving. "Aldred was here, in person, 3 months ago." Reeves looked at her. "He was already building the case," she said. "He came in under the inspection cover and he left something behind, something physical, most likely. Digital files have too many intercept points at his classification level. A physical copy is harder to remote wipe." The server room door was standing open again. Solis was inside, and beside her was a man Elise didn't recognize. Young, hospital IT lanyard, backed against the rack with his hands visible in the way of someone who had been told in clear terms to keep them that way. He looked terrified and genuinely confused, which was either authentic or very well performed. "He works nights," Solis said to Reeves. Login from his credentials triggered the alarm. He says someone accessed his workstation remotely.
"I didn't do anything," the IT tech said. His name badge said Drew. He was maybe 24, pale, sweating. "I was in the break room. I got the alert on my phone and I came up here and she was already—" He stopped. "There was someone in here. A woman. I didn't recognize her. She left through the stairwell when I came in." "Description," Reeves said. Drew gave one. Short, dark jacket, mid-40s, moving fast. Not Kovac. Someone else entirely. Elise was already at the terminal. The activity log was open, same session she'd been looking at 30 minutes ago, but there was new activity at the top. A search query had been run through the hospital's asset tracking system, the internal database that logged physical equipment and supply item locations down to the shelf level. The search term was Aldred Inspection 3-14. March 14th, 3 months ago. The search had returned one result before the session was cut off by the alarm. Elise read the location string on the screen. Storage Unit 7, Basement Supply Hold, Bin 14C. Item tag MED-EQ-UI-P-SURPLUS-031425. She straightened. "It's in the basement." Reeves was already turning. "Solis, I heard it," Solis said. They ran. The hospital basement was a different country from the floors above. No patients, no staff after midnight except occasional housekeeping runs. The air several degrees colder and carrying the smell of industrial cleaner and old concrete. The supply hold was a long room behind the boiler access corridor, lined floor to ceiling with metal shelving units holding tagged and cataloged surplus equipment. IV poles, decommissioned monitors, sealed boxes of outdated supplies that were kept for insurance documentation purposes before eventual disposal. The light in the supply hold was on. Reeves held up a fist. They stopped outside the door. He and the soldier beside him moved on either side of the frame in the practiced geometry of people who had done threshold entries before. Elise stayed back, which was the correct call tactically, and which cost her something to do. Reeves went in fast and low. The soldier followed. 3 seconds, then, clear. She went in. The room was empty of people, but bin 14C on the third shelf of Unit 7 had been pulled open. The tagged surplus item was a sealed cardboard box labeled as a decommissioned pulse oximeter unit. The box was intact, but had been moved. The dust outline on the shelf showed it had been pulled forward and pushed back, the tape seal on one end disturbed and repressed. Someone had gotten here first. Reeves cut the tape, opened the box. Inside, wrapped in bubble packaging, was the shell of an old pulse ox unit. He turned it over. The battery panel on the back had been removed and replaced. Not with a battery, but with a thin sealed envelope taped inside the cavity, edges pressed flat so the unit would close correctly. He pulled the envelope out. It was sealed with evidence tape. Government issue. The kind that showed tamper marks if opened. It was intact. Elise let out a breath she had been holding for the better part of 60 seconds. Reeves looked at the seal, then at the room around them. "Someone came down here and didn't get to it in time. They heard us on the stairs. Or they got what they actually came for, and this was secondary," Elise said. Reeves looked at her. "The search query was cut off by the alarm," she said. "But search queries log what was returned. There was one result. This box." She paused. "But the person who ran that search, they ran it knowing the inspection date and knowing the item tag format. That's specific. That's insider knowledge of how Aldred tagged the drop, which means there's someone in this building or connected to this building who knew about the plant before tonight, before the convoy, before any of this went active." She looked at the empty shelf where the box had been sitting for 3 months. The attack on the convoy, the access to the convoy route, the attempt to clean the server files, those could all trace to Kovac. But knowing Aldred's specific inspection drop protocol, that's a different level of access. The radio on Reeves's shoulder crackled. A soldier's voice. "Colonel, Trauma Bay 1. You need to come up. Now." The tone was wrong, not emergency protocol wrong. Something has changed wrong. They moved. The elevator was faster than the stairs for 3 floors. Elise watched the numbers and thought about the tapping finger against the gurney rail and the word "run" on Kovac's phone and the second person still unaccounted for somewhere in this building, and she thought about the sealed envelope in Reeves's hand and what it contained and who else already knew it existed. The elevator opened. Trauma Bay 1's glass panel showed activity, not the controlled activity of a stable critical patient, but the sharp, urgent movement of a room responding to a change. She could see a nurse at the head of the bed and Marcus Webb, who should not have been in that room but was, and both of them were looking at the monitor with the specific posture of people watching a number do something it should not be doing. She pushed through the door. Aldred's pressure had dropped, 74/50. His heart rate was up and irregular. The ventilator was alarming, not a displacement alarm, a compliance alarm, which meant his lungs were resisting in a way they hadn't been 12 minutes ago. Webb looked up. "He started deteriorating 4 minutes ago. I came in to check the chest tube and the output changed. It went from serous to dark red, fast." Elise was at the bedside. She checked the chest tube. Dark red output, increased volume. The controlled bleed was not controlled anymore. "He's rebleeding," she said. "The intercostal repair." Webb started. "It's not the intercostal. Look at the rate. This is higher volume than the intercostal would produce." She was already pulling on gloves, reaching for the ultrasound probe on the bedside cart. "There's a second source. The blast damage. The lung parenchyma. He may have a delayed pneumothorax on the right side, and if the pressure's building..." She ran the probe. The image came up on the small screen, low resolution, sufficient. She found it in under 15 seconds. A white line on the right where there shouldn't be one. Tension pneumothorax, building. The lung was collapsing against the mediastinum, and the pressure was beginning to compress the right heart. If it completed, his pressure would crash to nothing in minutes. "I need a large bore needle, 14 gauge, second intercostal space midclavicular line, right side. Now." She looked at Webb. "Right now, Marcus." He moved. Reeves had come in behind her and was standing at the door, the envelope in his hand, watching her work. She registered him peripherally and set him aside because Aldred on the table was the only object in her visual field that mattered. Webb had the needle. She took it, cleaned the site in 3 strokes, located the landmark by feel, second rib, mid-clavicular, top of the rib margin to avoid the neurovascular bundle, and inserted. The hiss of air was immediate and audible. Aldred's monitor tone shifted. The pressure began to come back. 78, 82, climbing. She held the needle in place and felt the tension in her shoulders release a single degree, which was all she could afford. "Chest tube on the right side," she said to Webb. "He needs a formal decompression. This is a bridge. Get Voss." Webb was already out the door. She held the needle. Aldred's finger moved against the rail. She looked down. His hand was flat, the finger still. She thought she had imagined it. Then it moved again. Not the SOS pattern from before. 2 slow taps. A pause. Then 1. She leaned close. "General, you're rebleeding. We're handling it. Stay still." His finger tapped once. She straightened and looked at the monitor. Pressure at 89, coming up. And then the overhead PA system activated. Not a medical code, not an emergency alert. It activated with a click and a half-second of open air, the sound of a microphone being keyed somewhere in the building, and then a voice came through it that she did not recognize. The voice was calm, professional, and it said 4 words that turned the temperature in the room down 10 degrees. "Release Kovac, or Aldred dies." The voice on the PA cut out clean, no static, no echo. Whoever had keyed the mic knew the system well enough to use it without feedback. That wasn't a person who had stumbled into a supply room and found a microphone. That was someone who had worked in this building, or had access to someone who did, and had identified the PA control panel location ahead of time.
Elise kept the needle in place with her left hand and did not look away from the monitor. Reeves was on his radio in 3 seconds, voice clipped. Lock the PA system. Find the origination point. All exits hard sealed. Nobody moves in or out. He crossed to the bed and looked at Aldred's vitals, then at Elise. How long does he have? At the current bleed rate, with the needle holding pressure, maybe 10 minutes before this becomes a surgical emergency, we can't manage in this room. She checked the chest tube output again. Still dark, still high volume. Where's Voss? I'm here. Voss came through the door with a chest tray already being rolled in by a scrub tech behind him. He had gloves on. He had clearly been listening to the PA because his face had an expression she had never seen him wear. Something stripped of the professional architecture. Something that was just a man understanding that the situation had exceeded every category he'd put it in. He looked at the needle in Elise's hand, at the monitor numbers. He didn't say anything about who had identified the tension pneumothorax. He simply moved to the right side of the bed and began the formal chest tube placement with the compressed efficiency of someone whose hands knew the job, regardless of what his head was doing. Keep it steady, he said to her, meaning the needle. I know, she said. They worked. The chest tube went in at the 5th intercostal space, anterior axillary line, Voss moving with a precision she had watched him apply to strangers for 3 years, and was now watching him apply to a man whose survival was tangled up with federal investigations and a voice on a hospital PA system and a sealed envelope sitting on the bedside cart. The drain connected. Dark fluid moved through the tubing. The compliance alarm on the ventilator stopped. Aldred's pressure held at 91. Voss straightened and looked at the monitors for a long moment. He was breathing slightly harder than usual, which was the only external sign of what this night had cost him. He needs the OR, Voss said. The right side bleed needs visualization. I can't manage this long-term at bedside. The corridor isn't cleared, Reeves said from the door. Then clear it. Voss turned. I understand there is a situation happening in this building tonight that is significantly above my clearance level or my interest level. What is not above my level is telling you that my patient needs a surgical suite in the next 30 minutes or we will lose the progress we've made. I don't negotiate that. Reeves held his gaze for 1 second. Then he was back on the radio. Elise stepped back from the bed and stripped her gloves. Her hands were steady. She noticed this in the detached way she noticed physical things when the rest of her was operating somewhere else. The part of her that was running parallel calculations about the voice on the PA and what it meant, and who in this building still had enough freedom of movement to use a PA system. The PA control panel was at the main nurses' station on the ground floor. She had seen it 100 times. A gray wall-mounted unit with a handset and a building zone selector, usually ignored, usually used only for overhead pages. It sat between the supply cabinet and the crash cart charging station, in a position that during a normal night shift was visible from the nursing station desk. During a normal night, not tonight, when the desk was occupied by federal agents and the floor was moving with soldiers, and every person with a legitimate reason to stand at that station was somewhere else managing a crisis. She left the bay. Reeves was in the corridor coordinating the OR route sweep, 2 soldiers moving ahead, the federal attorney on a phone, Solis coming from the stairwell, with her jacket damp from the rain that had apparently gotten into the stairwell on the lower landing. The building was a contained system that was no longer fully under anyone's control, and everyone in it knew it. The PA system, Elise said to Solis. Solis was ahead of her. Ground floor, main station. We checked. Handset was off the cradle. No prints we can use quickly. Everyone in this building has touched that panel at some point. Zone selector, Elise said. Which zone was selected? Solis stopped. She hadn't asked that. She pulled her radio and asked it. A voice came back. Zone 7. Zone 7 was the administrative wing, 4th floor, the same floor as the server room, Kovac's office, and the records archive. Someone had used a Zone 7 PA extension, not the main ground floor handset, a secondary handset. The administrative wing had 2 of them, one outside the boardroom and one inside the supply coordinator's office at the end of the hall. The supply coordinator's office. Elise thought about the procurement contracts, the vendor files, The federal medical supply agreements COVAC had restructured 4 years ago. Supply chain changes that had added administrative layers. A supply coordinator who would have operational knowledge of inspection protocols, storage systems, asset tagging. She thought about the search query that had found Aldred's drop location in under 60 seconds. The specific item tag format, the inspection date. "What's the name of your supply coordinator?" Reeves said. He had drifted close enough to follow the thread, Elise thought. The supply coordinator was a man she interacted with maybe twice a month. A quiet, careful man in his 50s named Roger Tarrant, who had been at North Ravine for 6 years, who knew every bin and shelf in the building, who had complained about the procurement contract changes when COVAC arrived, and then, about 18 months later, had stopped complaining. People stopped complaining for 2 reasons. One was that the problem was resolved. The other was that they became part of it. "Roger Tarrant," she said, "supply coordinator. He would know the asset tagging system better than anyone in this building." Reeves was on the radio before she finished. 2 soldiers redirected to the 4th floor administrative wing. He looked at Elise. "Stay with Aldred," he said. "Tarrant is not a physical threat," she said. "He's a 60-year-old supply manager. He had access to this building's systems, and he may have had access to operational information about Aldred's convoy route through the federal contract network. That makes him, I know what it makes him. I'm saying let me come." A beat. "Why?" "Because he's going to talk to me in a way he won't talk to soldiers." She held his look. "I've sat with this man in the supply coordinator's office complaining about requisition forms. He trusts me in the low-stakes way that people trust the people they see every week. That's worth something right now." Reeves considered it for exactly the amount of time it deserved. "Solis stays with you," he said. The supply coordinator's office was at the end of the 4th floor administrative wing, past Kovac's office, whose door was now open, the lights on, 2 federal agents visible inside pulling files, and past the boardroom with its long table and the projection screen still showing a budget presentation someone had been preparing for a meeting that would now never happen in its original form. The supply coordinator's office door was closed. Elise knocked. Silence. She tried the handle. Unlocked. She pushed it open. Roger Tarrant was sitting at his desk. He was a compact man with reading glasses pushed up on his forehead and a coffee mug that had gone cold hours ago. He was not running. He was not destroying anything. He was sitting in his chair with his hands folded on the desk, in the posture of someone who had reached the end of a very long internal argument and had come out the other side into something like exhaustion. He looked up when Elise came in. "Harmon," he said. Just that. The way people said your name when they had been waiting for the specific version of you to arrive. She sat down across from him. Solis stayed by the door, visible but not crowding the space. Elise had asked for this, and Solis was doing it correctly. "Roger," Elise said. He looked at his folded hands. "I heard they got Sandra." "Yes." "The soldiers, the federal people." He glanced toward the window, which showed only the dark parking lot and the rain. "I saw them coming in from up here. I've been sitting here since." He looked at her. His eyes behind the reading glasses were tired in a way that had nothing to do with the hour. "I knew this was coming. I think I've known for about 2 years." "Tell me what you know," she said. He told her. It took 11 minutes. He spoke in the even, detailed way of someone who had been organizing information in their head for a long time and was now simply reciting it, not performing, not minimizing, not trying to construct a favorable version. Just the facts, in sequence, from the beginning. The beginning was 4 years ago. COVAC had arrived and restructured the federal supply contracts, redirecting them through 3 intermediary vendors. Tarrant had noticed that the intermediaries were billing at rates 12 to 18% above market on specific high-cost medical equipment categories. He had flagged it internally. COVAC had told him the rates reflected security and compliance premiums on the federal supply chain. He had documented his concern in a memo that went into a file and was never referenced again. A year later, he was approached by a man who identified himself as a compliance consultant. The man had known about the memo. He had told Tarrant that the billing structure was not an administrative overage, but a deliberate diversion mechanism. That money was moving from federal medical accounts through the vendor intermediaries into private accounts connected to contractors who were also operating in the procurement space where Aldred's oversight authority applied. He had told Tarrant that if he cooperated, meaning if he provided access to the asset tracking system when requested, and answered certain logistical questions about the building when they came, he would be considered a protected source and not a target when the investigation eventually moved. He had believed this. For 2 years, he had believed it because he had needed to, because the alternative was acknowledging that he had made himself complicit. Tonight, the compliance consultant, a woman, fitting the description of the person Drew the IT tech had seen in the server room, had activated him. She had told him the investigation was moving, that Aldred had planted evidence in the building, that he needed to find it and remove it, and that doing so would close his liability. Instead, he had found the asset tag in the system and transmitted the location. He had keyed the PA, Zone 7 handset, and delivered the message she had scripted for him, hoping it would create enough disruption for her to retrieve the envelope and move it out of the building. He had not known, until the soldiers appeared at the exits, that retrieving the envelope and moving it out of the building was no longer possible. "The woman," Elise said. "The consultant." Tarrant opened his desk drawer and took out a business card. He slid it across the desk. The card was clean, professional, a name and a federal agency identifier that Elise did not immediately recognize, and then recognized in the second look as a department designation that did not quite match any legitimate federal structure she knew, which meant it was a construction, a convincing construction. She turned the card over. On the back, handwritten in small, clean print, was a cell number. She passed it to Solis. Solis looked at it, pulled her phone, took a photograph, and was on the radio in the next breath. Tarrant watched all of this. "I was going to lose my pension," he said. Not as a justification. He said it the way people named the thing that had broken them, factually, without expecting sympathy. Elise looked at him. She was tired enough that the edges of the room had developed a slight unreality, and she was acutely aware that she had been awake for 23 hours and had spent the last 4 of them moving through a building that had been systematically reorganized into a crime scene around her. She thought about what to say to a man who had allowed himself to be used over 2 years by people who had correctly identified the thing he couldn't afford to lose. "You need to write all of that down," she said. "Everything you told me. Every date, every name, every conversation. Right now, before anything else." She pushed a legal pad from the edge of his desk toward him. "It's going to matter that you did it voluntarily, and it's going to matter that it was complete." He picked up a pen. She stood. Her knees registered a dull protest she didn't have time for. She found Reeves in the corridor on his phone, and she gave him the 2-sentence version of what Tarrant had told her. He listened without interrupting, then said 2 words into his phone that she didn't catch, and then, "The consultant. We need her. She's the operational link. Without her, the contractor connection is circumstantial." "The number on the card," Elise said. "If she's still in the building—" "She's not in the building," Reeves said it with certainty. "We would have her. She got out before the exits were hard sealed. She came in, tried to get the envelope, failed, ran the PA play as a distraction, and exited." He looked at the business card in a sealed evidence bag that Solis had just handed him. "She had an exit plan before she came in. This was not improvised." Which meant the operation had multiple layers. Kovac was the administrator layer. Tarrant was the logistics layer. The consultant was the operational layer. And above all of them was whoever had designed a system capable of diverting $400 million through a federal medical supply chain, and then, when that system came under threat, of staging a convoy explosion to eliminate the investigating general. That person was not in this building. That person was probably not in Wyoming. Aldred's sealed envelope in Reeves's jacket pocket was presumably the document that could identify them. Reeves looked at Elise. She could see him running the same calculation. "Open it," she said. "Not here. This goes to the field office under chain of custody." "Reeves," she kept her voice below the level of the corridor. "You have a patient in that bay who was shot twice, had a blast injury staged over the wounds, developed a tension pneumothorax, is heading to an OR in the next 20 minutes, and whose survival is not guaranteed. If that envelope documents what I think it documents, and if the person at the top of this has any remaining capacity to reach into this building tonight." "They don't," he said. "We're sealed." "You said the consultant had an exit plan. She was inside this building after your soldiers came in. If she was inside with an exit plan, someone with operational access helped her design it. She let that sit for a second. Open the envelope, Reeves, in front of witnesses. Document it here. Don't let it travel outside this building tonight as the only copy. He looked at her for a long moment. There was a history between them that wasn't being spoken, that was sitting in the corridor between them the way it had been sitting since he said her name in the ER 3 hours ago. 6 years of it. The classified mission, the file reassignment she had accepted, the career that had ended, the clearance he had never pulled. All right, he said. They did it in Kovac's office, which was the largest space on the floor and was already a documented federal evidence site. Reeves, Solis, the federal attorney, and Elise. Reeves opened the envelope with a letter opener from Kovac's desk. He extracted a folded document, 6 pages, printed, with a cover sheet bearing a classification marker and a date 4 months ago. The attorney read it first, silently, standing. He was 3 pages in when his expression changed. Not dramatically, not the way faces changed in films, but in the small, contained way of someone who has just confirmed something that changes the scale of what they are dealing with. He looked up. This is a full financial trace, he said. 14 months of transactions, vendor accounts, holding accounts, disbursement records. This goes significantly further than the hospital contracts. He turned to page 4. There are names here, 6 names. 2 of them are currently holding federal positions. The room went quiet in the particular way of people processing the weight of a thing. Which positions? Reeves said. The attorney told him. Elise looked at the window. Outside, the rain was still coming down over the dark parking lot of North Ravine Medical Center, and the military vehicles were still positioned at the entrance, and somewhere in Callaway, Wyoming, the night was doing what Wyoming nights did, which was proceed with complete indifference to what human beings were constructing inside buildings. She thought about Tarrant in his office, writing on a legal pad. She thought about Kovac, in federal custody somewhere on this floor, her hands no longer flat on a counter. She thought about Voss downstairs, prepping an OR to fix a wound in a man whose survival was the anchor point of everything that happened next. She thought about Dale Pruitt in his step-down unit, 3 floors below, whose cardiac team was probably changing shift right now with no idea that the building around them had been taken apart and rebuilt in the last 4 hours. Harmon. Reeves was looking at her. I need to brief you on something. She waited. Aldred's inspection visit 3 months ago, he said, the one where he planted the envelope. A pause that had something in it. He had a list of personnel at this facility who were under active review as potential persons of interest in the procurement investigation. The list was generated from communication intercepts and financial cross-referencing. And? Your name was on it, he said. The words landed with the specific impact of something that was not entirely a surprise and was simultaneously worse than expected. She stared at him. For 6 weeks, he continued, measured, careful. You were flagged as a potential insider contact based on your employment at this facility and your previous military record and the gap in your documentation between discharge and civilian employment. He held her gaze. You were cleared off the list 5 weeks ago. The investigators found no financial connection, no communication links, nothing actionable. You were removed. He paused. I'm telling you because you have a right to know it happened, and because it matters to what comes next. She absorbed this. She had been investigated, while working her shifts, while flagging Pruitt's cardiac event, while getting suspended by Kovac. Someone in a federal office had been running her name through intercept databases and financial trace programs, looking for a thread that would connect her to a conspiracy she had never heard of. They had found nothing because there was nothing. That was the correct outcome, and it did not make the knowledge of the process comfortable to carry. What comes next, she said. Your cooperation in this investigation is going to be formally requested. Everything you documented tonight, everything you observed, everything you know about the operational structure of this facility, we need it on record correctly, with full legal protection for you as a cooperative witness. I'm already a cooperative witness. I've been cooperative since 2:37 in the morning when I drove here on a suspended badge. I know that. Something in his voice shifted slightly, not softening exactly, but acknowledging.
You didn't have to come back. She thought about this, about the text from Webb and the news footage and the drive through the dark and the scrubs she'd put on because she couldn't not. Yes, I did, she said. He nodded once. It was small and contained and meant more than a larger gesture would have. His radio activated. A soldier's voice. OR is cleared and ready. Dr. Voss is requesting patient transfer in 5 minutes.
Reeves looked at Elise. Go! She went back downstairs. The OR prep was controlled and fast. Aldred was moved from Trauma Bay 1 to Surgical Suite 2 with 4 people on the gurney and 2 soldiers clearing the corridor ahead, and the entire transfer took 4 minutes and 30 seconds, which was exactly the kind of time she expected when Voss was running a transport. He was many things, but he was not slow when a patient was moving. She followed the gurney to the OR suite door and stopped there, because the OR was Voss's territory, and she was not scrubbed, and she had reached the edge of what she could physically manage in this particular stretch of crisis. She stood at the window in the scrub corridor and watched through the glass as Voss and his team positioned Aldred under the surgical lights. She had been awake for 24 hours, and her feet were registering the full length of the shift she had never officially been on. She leaned against the wall beside the window and stayed there because sitting down felt like a gamble she couldn't afford. The specific calculation of someone who knew that if they stopped moving, they might not be able to restart. Marcus Webb appeared at the end of the scrub corridor. He looked like she felt stretched past his standard operational capacity and running on the emergency reserve underneath it. He walked to her and stood beside her, both of them looking through the window. Is he going to make it? Webb said. Voss is good, she said. He has a real chance. Webb was quiet for a moment. What happens now? To the hospital? To all of us? She thought about the attorney reading page 4 of Aldred's document. 6 names, 2 current federal positions. It gets investigated, she said. Properly. All of it. And Kovac? Kovac made choices tonight that she's going to answer for. And Voss? He said it carefully, the way residents said things about attendings when they genuinely didn't know the answer and understood that not knowing it had consequences. She looked through the glass at Voss working, at his hands moving with precision over a man who needed precision more than anything else in the world right now. Voss is in that room doing his job, she said. That counts for something. She meant it. She was also aware it was not a complete answer, and Webb, who was not stupid, understood that it wasn't meant to be. At 4:47 a.m., Solis appeared at the end of the corridor. Her expression was the contained version of something significant. The cell number from the card, Solis said. The consultant. We ran it. She paused. It's registered to a defunct corporate entity. The entity dissolved 8 months ago, but the payment records for the phone account trace to an operating account. Another pause. The account holder is a company called Meridian Medical Solutions. Elise looked at her. Meridian Medical Solutions is listed as a primary vendor on North Ravine's restructured federal contracts, Solis continued. The contracts Kovac set up 4 years ago, the ones being audited in Aldred's investigation. Meridian is the intermediary company, Elise said, the one Tarrant identified as billing above market rates. Yes. Solis looked at her evenly. Meridian Medical Solutions is also listed as the contracted supply consultant for 4 other regional medical facilities in 3 states. All 4 are connected to the same federal procurement classification that Aldred was auditing. A breath. And the registered agent for Meridian, the person who legally incorporated the company. She stopped. Who is it? Reeves said from behind Elise. He had arrived at some point in the last 30 seconds without her noticing. Solis looked at him. The registered agent is a person named Howard Pell. The corridor was silent except for the ventilation system and the distant sound of Voss's surgical suite. Dr. Howard Pell, cardiologist. The man Voss had been walking with at the nursing station the night Elise had escalated Prewitt's cardiac event. The man who had been present in the building for years, adjacent to every significant administrative decision, connected to the supply chain through a corporate structure so clean it had never generated a second look. The man who had been standing 15 feet from Elise when she was walked out of the building 6 hours ago. Where is he? Reeves said. Solis's expression answered before her words did. We've checked every floor, she said. He's not in the building. A beat. His car is still in the physician lot, she said. His phone last pinged a cell tower 4 blocks from here at 3:22 a.m. She looked at Reeves. Someone picked him up, and whoever picked him up knew to do it exactly 6 minutes before your exterior perimeter went fully active. 6 minutes. The margin of a person who had known the timing because they had helped design the response protocol being used against them. Reeves looked at the sealed evidence bag in his hand. Aldred's document. 6 pages, 6 names, 2 federal positions. Pull the names on page 4, he said to Solis, quiet and very precise. Cross them against anyone who has had access to our operational response timeline tonight. The implication of that sentence was a room no one wanted to walk into. Solis was already moving. Elise turned back to the window. Inside the surgical suite, Voss was working, his team steady around him, and Aldred's vitals on the wall-mounted display were holding in the range of a man who was fighting and had not yet lost. She put her hand flat against the cold glass. Somewhere in the pre-dawn dark outside this building, Howard Pell was in a car moving away from Callaway, Wyoming, with 6 minutes of lead time and the knowledge that the evidence that could most directly connect him to the operational center of everything that had happened tonight was sitting in a jacket pocket 30 feet from an OR where his carefully constructed world was in the process of being surgically dismantled. And the person who had told her to look at his patient's intercostal space, the person who had put the right pressure in the right place at the right moment, was standing in a hospital corridor with cold glass under her palm and the specific knowledge of someone who understood that the hardest part of any operation was not the crisis. It was the hour after, when the structure became visible, and you had to look at all of it. The glass was cold under her palm, and she kept it there for another few seconds, feeling the temperature move through her hand, because sometimes the body needed something physical to hold on to when the mind was running faster than it should. Then she pushed off the wall and went to find Solis. The federal attorney had set up a working space in the 4th floor conference room, the same room where Sandra Kovac had told Elise less than 12 hours ago that security would escort her to collect her personal items. The table now held laptops, printed documents, evidence bags, and 3 people who had been awake long enough that the professional precision was starting to show its seams. Solis was at the far end, cross-referencing something on 2 screens simultaneously. She looked up when Elise came in. Page 4, Elise said. The 2 federal positions. Cross them against the operational response timeline. Do it now, before Pell gets further. Already running it. Solis turned one of the screens. First name is a Deputy Procurement Director at the Department of Defense. Second name is a Senior Compliance Officer with the Federal Medical Oversight Board. She paused. The Compliance Officer, his office received notification of tonight's convoy route 18 hours ago. Standard security briefing for a general officer transport. His office is one of 9 that received it. 9 offices, Elise said. How many of the other 8 are connected to Aldred's audit? 2 others, but those 2 were also notified about Aldred's previous convoy routes on his last 3 inspection visits. All 3 previous convoys moved without incident. Solis looked at her. Tonight was the first time the route was activated within hours of Aldred finalizing the evidence document. The document we have in that envelope. The timing was the mechanism. Aldred had finalized his evidence, which triggered some alert somewhere in the network. A system access log, a document print record, something that told the people on the other end of this that the window for stopping him before testimony had compressed to hours. They had activated the convoy attack on short notice, which meant the convoy route information had been pulled fast from whoever received the security briefing. The compliance officer, Elise said. Where is he right now? Washington. His office confirmed he's in the building. We have federal agents making contact as of 4 minutes ago. Something released slightly in Elise's chest. Not relief exactly, but the specific sensation of a variable being brought under control. And Pell? Solis's expression answered that too. Cell tower hit, she said, 40 minutes east of Callaway. He's on the highway. We have Wyoming State Police and a federal intercept team moving to that corridor now. She paused. He didn't fly. He doesn't have enough distance yet to reach an airport with an outbound flight before the intercept team cuts the highway options. He knows that, Elise said. Probably. So he's heading somewhere specific, not running blind. Solis leaned back slightly in her chair. There's a private airstrip 47 miles east, registered to an agricultural holding company. The holding company has no surface connection to Meridian Medical Solutions or any of the contract entities. But the registered agent, she stopped and almost smiled, which on Solis's face was a very small thing. The registered agent filed incorporation paperwork using the same notary in Denver, who filed 3 of Meridian's subsidiary documents. The structure kept revealing itself, layer by layer, the way structures did when they started to come apart. Not from the outside in, but from the inside out. Because the connections that held the thing together were the same connections that exposed it once someone started pulling threads. Howard Pell had spent years as a cardiologist at North Ravine, adjacent and accessible and useful, the kind of man who stood at nursing stations and walked with attending surgeons and occupied the background of every significant administrative moment without ever appearing to be at the center of it. He had built Meridian through a layer of registered agents and subsidiary shells and a notary in Denver, and he had sat in morning meetings and hospital charity events and peer review committees while $400 million moved through a pipeline he had designed. He had been 15 feet from Elise when she walked out of this building. She thought about that, about what it meant that she had spent 3 years in the same building as Howard Pell, had probably crossed paths with him 100 times, had maybe handed him a coffee from the break room without either of them registering the exchange as anything worth remembering. The invisibility worked both ways. She had been background noise to everyone in this building. He had been furniture to her. The difference was that his invisibility had been engineered. Reeves appeared at the conference room door. He had his jacket back on, which meant he was moving. Intercept team has a visual on Pell's vehicle. He's 12 miles from the airstrip. The airstrip needs to be locked before he gets there, Elise said. It's being locked. He looked at her with the expression of someone delivering information that had been weighed before speaking. I need you to know something before this moves into its next phase. Aldred's document, the 6 names, the financial trace, it's been transmitted to 3 separate federal jurisdictions as of 20 minutes ago. Copies are in the hands of people who don't know each other and have no common chain of command. Whatever happens to the physical document, the content is protected. She understood what he was saying without him having to say it plainly. He was telling her that even if something went wrong with the document, with the intercept, with the building, with him, the information was already distributed beyond the point where it could be contained. Good, she said. There's something else. He came fully into the room and closed the door behind him. When this investigation formalizes, and it is going to be extensive, multi-agency, the kind that runs for years, your testimony is going to be central. What you observed, what you found, what you did tonight. The legal team is going to want you on record within the week. I'll be on record. It also means your previous service is going to become relevant, the classified mission, the file reassignment, the circumstances of your discharge. He held her gaze. I've already initiated a formal review of your military record. The incident that ended your career, the blame assignment you accepted, there were 3 people in my unit at the time who knew the actual sequence of events. One of them put it in a sealed statement 4 years ago, after the fact, because he said he couldn't keep carrying it. A pause. I've had that statement for 4 years. The room was very quiet. Why didn't you? She stopped. She knew why. Because classified was classified. Because the statement alone wasn't sufficient to trigger a formal review without an initiating authority willing to stake their own credibility on opening the file. Because the military machine moved on its own timeline and its own terms, and the initiating authority had been Reeves himself, and he had needed a moment, a crisis, a convergence, a night where everything came apart at once, to be the moment where the review became possible. I'm sorry it took this long, he said. She looked at him. There were several things she could have said. She chose the one that was true and brief. It's done now. He nodded. It's done now. The radio on his shoulder activated. The voice said, Vehicle stopped. Subject in custody. Airstrip is clear. Howard Pell had been 12 miles from whatever exit he had planned for himself, and now he was on the shoulder of a Wyoming highway in the pre-dawn with state police lights behind him and a federal intercept team in front, and the elaborate structure he had built over 4 years of careful, patient, invisible work was in the process of being disassembled by people who had the document that showed how all of it connected. Elise sat down in one of the conference room chairs, which was the first time she had sat down since leaving her kitchen 8 hours ago. She sat there and breathed for a moment. General Marcus Aldred came out of surgery at 6:14 a.m. Voss found Elise in the scrub corridor where she had been for the last 40 minutes, half sitting against the wall on a chair that a night shift tech had brought her without being asked. He came through the OR doors still in his surgical gown and stopped when he saw her. "He's out," Voss said. "Right lateral repair is solid, chest tubes are in bilaterally, pressure is 118/74 and stable. Barring complications, he has a real path to recovery." She let that land. "Good," she said. Voss looked at her for a moment. He had the look of a man who had been awake through a surgical emergency and was running on the particular clarity that sometimes came at the end of a very long night, when the performance of authority had burned off, and what was left was just the person inside it. "The STEMI patient," he said. "Prewitt, 2 days ago." "Yes. You were right, and I was wrong." He said it directly, without cushioning it or surrounding it with qualifications. It was probably the hardest collection of words he had assembled in years, and she could hear that in the texture of it. "I looked at 40 seconds of data and I made a call, and I was wrong. You looked at a pattern over 40 minutes and you were right." She considered several responses. "Thank you for saying that" was true but incomplete. "I know" was accurate but unkind. What she settled on was the thing that was both honest and actually useful. "You saved Aldred tonight," she said. "Your hands did. That also matters." He looked at her, really looked at her, in the way he probably hadn't in 3 years of occupying the same building. "Who were you before you were here?" "Someone who saw a lot of things in difficult places," she said. "Then I came here and tried to be less." "You were never less," he said. It was not a compliment she had expected from him. She wasn't sure it was exactly a compliment at all. It was more like an observation from someone who had spent the night updating a calculation. But it was real, and it landed in a place she had kept carefully defended for a long time. She nodded once. He went to find coffee or sleep or whatever came after the kind of night he had just had. She stayed in the corridor for another few minutes, listening to the building around her come back to itself. The shift change starting, the early morning sounds of a hospital returning to its routine, monitors and carts and voices at a normal register for the first time since 2:37 a.m. The next 2 weeks were not a resolution. They were a process, which was what resolution actually looked like from the inside. Not a clean moment of conclusion, but a sustained, grinding forward movement through testimony and documentation and legal procedures and formal reviews that had no interest in narrative clarity. Elise gave her full account to federal investigators across 3 separate recorded sessions. She gave it accurately and completely, with timestamps and clinical details, and direct quotes where she had them, because she had always understood that documentation was the only kind of protection that didn't require someone else's goodwill to function. The investigators were professional, thorough, and not particularly warm, which was appropriate for their purpose. Sandra Kovac was formally charged on 7 counts, including obstruction of a federal investigation, destruction of federal evidence, and conspiracy in the conduct affecting a government officer. She had declined to cooperate beyond the initial detention and had transferred all communication to her legal team, which was her right, and which the evidence did not require her to waive. Roger Tarrant cooperated fully. His legal situation was complicated and ongoing, but the voluntary statement he had written on a legal pad at 3:30 in the morning became, in the language of the federal prosecutor who referenced it, substantively significant to the case's evidentiary foundation. He was not offered immunity. The federal machinery did not work that quickly and did not make promises it couldn't budget for. But his cooperation was on record, and on record was a different position than the one he had occupied an hour before he picked up the pen. Howard Pell was arrested on the highway shoulder at 5:02 a.m. and transported to federal custody. The charges against him were longer than the charges against anyone else in the network, because Meridian Medical Solutions was the center of the operational structure, and Pell had built and managed it. His attorney issued a statement that used the word unprecedented 3 times and the word fabricated twice, which told everyone familiar with these kinds of statements exactly what the defense strategy was going to look like and exactly how much weight it was likely to carry against 14 months of financial transaction records. The two federal officials named in Aldred's document, the deputy procurement director and the compliance officer, were placed on administrative leave within 48 hours of the document's transmission. The formal investigations into their conduct were announced publicly, which meant Elise read about it in a news alert on her phone while sitting in her apartment eating the breakfast she had not had time to eat for 2 days. She read the article. She put her phone face down on the table. She finished her eggs. Osek. General Marcus Aldred was transferred out of North Ravine Medical Center to a federal medical facility on day 4 when his condition was stable enough for transport. He was conscious by day 2, extubated, alert, the particular alertness of someone who had come back from a significant distance and was taking careful inventory of what remained. He had asked to see Elise on day 3. She had gone to his room in the step-down unit expecting a brief interaction, a formal acknowledgement, a statement for the record, something official. What she got was a man propped at 45 degrees in a hospital bed with drainage tubes and IV lines, and the weathered face of someone who had spent decades in difficult places, looking at her with an expression that was unguarded in the way that people became unguarded when they had recently been very close to not existing. "I heard you were the one who caught the pneumothorax," he said. "Voss placed the chest tube," she said, "after you found it." He looked at her steadily. "Reeves told me the full picture, all of it." She waited. "I also heard you were suspended the same night we came in," he said, "over a cardiac call that saved another patient's life." "That situation is being reviewed." "It's been reversed," he said, "as of this morning, formally. I'm told the paperwork went through with significant support from the Federal Oversight Board, which is currently in the process of being reorganized but still has the authority to move on personnel matters connected to the investigation." A pause. "You're reinstated. Full record. No notation." She had known this was coming. Reeves had told her the review was moving. But hearing it stated plainly, in a room in the building where she had been walked out by a security guard who couldn't meet her eyes, produced a physical sensation she hadn't fully anticipated. Not triumph, not vindication exactly. Something quieter and more complicated. The feeling of a wrong being corrected, which was not the same as the wrong never having happened, and which she was mature enough to understand the difference between. "Thank you," she said. "Don't thank me." He said it without harshness. "The review found what it found because it was there to find. You built the record that made it findable." He shifted slightly in the bed, with the careful movement of a man whose chest wall would be registering complaints for some time. "I've been in federal service for 31 years. I've watched institutional systems protect the people who were wrong more times than I can count. What happened in this building last week is—" He stopped. "It doesn't always work out. I want you to know I understand that. The fact that it did here has a lot to do with choices you made when nobody was watching." She thought about 2:37 a.m., the text message, the scrubs she had put on because she couldn't not. "I'm going to testify," he said. "When I'm cleared for transport and the hearing is scheduled, I'm going to testify, and the document I left in that supply room is going to be part of the evidentiary record. The people who tried to stop that are in federal custody or under investigation." He looked at her with the directness of someone who had used up his patience for indirect communication sometime in the last several days. "What are you going to do?" It was not a casual question. She looked at the window. Outside, Callaway was doing what it did in the morning. Flat light, cold air, the mountains in the distance holding whatever weather was building behind them for later. She had come to this town trying to be quieter than she was, trying to occupy less space, trying to turn down the volume on the part of herself that had been formed in circumstances she hadn't chosen and couldn't fully leave behind. She had thought of it as recovery for a long time. Lately, in the last few years, she had thought of it as something closer to shrinkage, a slow process of becoming less than she actually was, in the hope that less would be safer. It hadn't been safer. It had just been less. "I'm going to keep working," she said. "Here. This is where I work." Aldred nodded slowly. "Good answer." She stood. At the door she paused. "Your finger," she said. "In the trauma bay, when you were sedated, you were tapping. He looked at her with something that was almost amusement. "I know who you are," he said. "I had your file. I knew you were at this facility. When I came to in enough to know anything, I needed you to know I was in there." A pause. "And that I trusted you." She stood with that for a moment. "I'll come back before your transfer," she said. "I know you will," he said. The hospital reorganization began the following Monday. With Kovac under federal indictment, the board moved fast, faster than institutional bodies typically moved, which suggested that several board members had been waiting for an opportunity to move that Kovac's presence had made impossible. An interim administrator was appointed. The supply contracts Kovac had restructured were suspended pending federal review. The vendor relationships connected to Meridian were terminated with cause, which would generate its own litigation, which was a problem for attorneys. Garrett Voss was not charged with anything. The investigation had found no evidence connecting him to the procurement network. He had been, as Elise had begun to suspect on the night of the convoy, a tool of a different kind. A high-profile attending whose professional authority could be leveraged to create clinical outcomes favorable to whoever needed them. He had not known he was being leveraged. His ego had made him easy to use, and he had operated in the building structure without ever seeing the structure clearly, which was its own kind of culpability even if it wasn't a criminal one. He knocked on the door of the supply coordinator's office on a Tuesday morning, which was where Elise was working because her own office situation was in transition, and the supply coordinator's office was empty because Roger Tarrant was on administrative leave pending the investigation's progress. She looked up. Voss stood in the doorway. He had his badge on and his coat on, and he looked like himself. The full assembled version of Garrett Voss, authority and posture and the professional architecture intact. But something in the set of his jaw was different, in the way that people who had been through a significant reckoning were different even when they were trying to look exactly the same. "The trauma division restructuring," he said. "The interim administrator asked me to put together a proposal for the new leadership structure." "All right," she said. "I want you in it." He said it the way he said difficult things, directly, without softening it, because softening was not in his nature. Senior Clinical Coordinator for Trauma Operations. It would involve protocol review, staff development, oversight of triage decision-making in complex cases. He paused. And it would mean that when a nurse identifies a clinical issue, there is a formal structure for that identification to move efficiently without requiring anyone to circumvent anything. She looked at him for a moment. "That's a position that should have existed before," she said. "Yes," he said. "It should have." She thought about what she had told Aldred. "I'm going to keep working. Here." She had meant it when she said it, and she meant it now, but meaning it and knowing what shape it would take were different things. "Send me the proposal," she said. "I'll read it and tell you what needs to change." Something in Voss's expression shifted. Not quite relief. Something more like the recalibration she had seen on the night of the convoy, the ongoing process of a man updating his understanding of a situation he had been wrong about for a long time. It wasn't comfortable for him. She didn't need it to be comfortable for him. She needed it to be real, and she thought, provisionally, that it was. "I'll send it today," he said. He left. Marcus Webb appeared in the doorway approximately 90 seconds later, which suggested he had been in the hallway listening. He came in and sat down in the chair across from her with the ease of someone who had decided at some point in the last week that formality was unnecessary, and she had not corrected him. "He offered you the coordinator position," Webb said. "You were listening." "The door was open. Did you take it?" "I told him to send the proposal." Webb nodded. He had the particular expression of a young physician who had survived a significant formative experience and was still in the process of integrating what it had cost him and what it had given him. He would be a good doctor, Elise thought. He was already a good doctor. He was going to be the kind of physician who remembered that the person next to him, in a clinical moment, might know something he didn't, not because his training was insufficient, but because knowledge came from more sources than training could account for. That was not a small thing to learn at 27. "Thank you," he said, "for that night, for what you did." She looked at him. He meant it plainly and completely, and she received it the same way. "You made the right call on Prewitt," she said, "when it mattered and it was difficult.
That was you." He nodded, not dismissing it, not inflating it, just taking it in the size it actually was. He stood to leave, then stopped. "Harmon, for what it's worth, the people who worked with you, the staff, the ones who watched you get walked out that night." He paused. "They know what happened. They were watching." She thought about the night shift nurses who had found reasons to be near the nursing station when she had been suspended. The tech who had brought her a chair in the scrub corridor without being asked. Terrence, the security guard, who had walked her out with his eyes down. People noticed more than they said. They always did. The question was what they did with what they noticed, and the answer to that question was almost never as simple as it looked from the outside. "I know they were," she said. 3 weeks after the convoy came through the emergency bay doors, Elise was working a day shift when her phone vibrated with a notification from a number she didn't recognize. The message was a photograph. It showed a federal courtroom gallery taken from the back, rows of seats, the high windows, the formal geometry of a space designed to contain consequential proceedings. The caption read, "Pell arraigned this morning, Kovac next week. It's moving." The sender's name, when she scrolled up to the contact card, was saved as Reeves, D. She had not had his personal number before. He had put himself in her contacts at some point, she hadn't seen when, and the photograph was the first message in the thread. She typed back, "Thank you for telling me." 3 dots appeared. Then, "Your record is officially cleared. Full reinstatement of service classification. It goes into the permanent record today." She stood at the nursing station with her phone and read that sentence twice. Her military record. The classification she had carried for 4 years as a combat medic, attached to a joint special operations unit. The service that had ended in a classified incident in a country whose name wasn't in her file, when she had accepted a blame reassignment that wasn't hers, and disappeared into civilian life with 8 months of travel nursing as a buffer between who she had been and who she was trying to become. All of it restored, the truth of it on record. Not erased. The event had happened, the years had passed, the cost had been paid, but corrected. Named correctly. The record saying what the record should have said. She put her phone in her pocket. Down the hall, a call light activated over room 12. She noted it and started moving, because that was what you did. You noted it and you moved, because the person in room 12 had a call light on, and that was the immediate, present, solvable thing in front of her. This was the part that people who stood outside the work didn't always understand. The vindication, the record correction, the federal charges and the formal reinstatements and the coordinator proposals, all of that was real, and it mattered, and she was not going to pretend it didn't. But it existed alongside the ongoing, continuous, present-tense fact of the work itself. Room 12 had a call light. Someone needed something. She was the person in the corridor. She had always been that person. It was the part of her that had never required validation to function, and it was the part of her that the people who had tried to remove her from this building had most completely failed to understand. You could suspend a badge. You could escort someone to the parking lot. You could deactivate a credential at midnight and write a formal statement about circumvented clinical authority. What you could not do was change what a person knew, or make them not know it, or convince the part of them that recognized a tension pneumothorax and a staged wound pattern and a cardiac event in progress that those recognitions were above their station. Elise Harmon had spent 3 years trying to be background noise in a building that needed her to be exactly what she was. She had spent 4 years before that being exactly what she was in places that had taken more from her than she had agreed to give. She was 31 years old, and she was tired in ways that didn't show on her face, and she had a call light waiting, and a coordinator proposal to read, and a formal testimony to prepare, and a military record that now said the true thing. She was not the person they had thought she was. She had never been. She pushed open the door to room 12. "Hi," she said. "What do you need?" The patient, a 60-year-old man with a hip replacement, scared about his pain medication timing, wanting to know if he could call his daughter, looked at her with the specific relief of someone who had pressed a button into the unknown and gotten an actual person. "Sorry to bother you," he said. "You're not bothering me," she said. She pulled the chair close and sat down, because she had learned in the years before this building and the years inside it that the most powerful thing you could do in a room with someone who was afraid was to make clear you were not in a hurry to leave it.
Tell me what you need, she said, and she listened.